Hi, I'm Amy Olak, the CEO of the Washington County Commission on Aging, and I welcome you back to Living In with Amy. Today, you've probably already heard about the executive order to wear masks in public, and today I'm going to talk to you a little bit about those masks. I have a mask here today that looks like one that you would be given at your physician's office even before COVID came in, that you would see if you had respiratory symptoms. They may ask you to wear these. So just simply put that on, covering the bridge of your nose, clamping it down so there's a firm fit, covering your mouth, and putting these behind your ears. This is exactly how you would don the mask or put this mask on, making sure when you remove the mask that you're using the earpieces with your hands and not touching so that you can actually reuse this mask again. So one of the things that you've heard about are N95 masks. These masks are being reserved for healthcare workers and first responders. I have a few of them here today. I'm not going to go into great detail about them, but wanted you to see that there are quite a variety of different ones available for healthcare workers to use. But please save these for the healthcare workers. Today I'm going to talk to you about some things around your house that you may have that you can use to create a mask, maybe a scarf or a bandana. So I have a handy dandy bandana here. Folding that bandana to make sure that it will cover your nose and mouth. I've used on one side of the bandana a rubber band. You can use hair ties, anything that you can tie that up with. It just makes it easier to stay together. Inside the bandana, you could place one of these blue shop cloths. I understand these blue shop cloths are wonderful filters. Again, these are just mechanisms to help reduce the exposure to secondary infections, not necessarily to avoid droplet exposure to COVID, but placing this inside of your homemade scarf or bandana, covering it, folding it, putting another rubber band on the other side, and then putting it on your mouth, covering your nose and your mouth, and tying it behind your head is another great easy way. You can do that with a scarf. So if you don't have one of these blue shop cloths, you could actually use a coffee filter. Again, the same mechanism, putting it inside of the bandana. You could use a napkin, or you could actually even use a tissue. So one of the things that you've probably seen are homemade masks that are fabric. The same techniques could be used inside the mask. You can actually slit the bottom of the homemade mask, put this up inside the fabric, put a little pin there, and put it back on. So again, these masks have ears. You may actually see masks that look more like this actual tool that actually ties behind your head. So it kind of reminds me of a surgical mask that you may have seen in hospitals, but this is a cloth mask. Anything that you can put in there to layer it and protect you and put another layer of filtering inside that mask is just an added benefit for you. Again, none of these are set up to protect you from COVID 100%, but if everyone is wearing them and social distancing, it will definitely reduce the potential for your exposure. Another great tool is to have a pair of gloves. If you don't have gloves, washing your hands with soap and water frequently for 20 seconds. And if you don't have access to soap and water, so for example, if you're at the store and you're getting back in your vehicle, make sure you have alcohol-based hand sanitizer of at least 60% alcohol. So washing your hands, wearing masks, wearing gloves. Another great thing is to take your shoes off before you come in the house. So taking care and protecting yourself and your loved ones is super important, but just a few ways to take care of yourself is making sure that you are wiping off that cart at the grocery store, wearing your mask, washing your hands, using gloves if you have them, but making sure you're taking care of yourself. If you or any of your loved ones become symptomatic, you should be calling your primary care physician. And if you don't have access to a primary care physician, I would recommend that you visit the Meritus website and consider telehealth. The website will be posted below. Again, check your Washington County Health Department website for updates. And again, the CDC is a wonderful website to go to for updated information on this COVID virus. But remember, stay healthy, stay active, drink water, get up and move. Social isolation is real. It really is alive today. Pick up the phone, reach out to a loved one, call a neighbor, tell them you're thinking about them, but most importantly, take care of yourself. Wear your mask, wash your hands, and sit back and enjoy living in.